A good morning from Dallas, where the latest confirmed Ebola case in the U.S. now prompting questions and concerns. Hospital officials here in Dallas now hoping to find out exactly how one of their nurses now ended up a patient.
We don't know what occurred, but at some point there was a breach in protocol.
The CDC says that breach of protocol caused the first case of Ebola contracted in the U.S. A nurse at Texas Health Presbyterian Hospital has tested positive for the disease. She treated Thomas Duncan, the Liberian man who flew to Dallas, fell ill, then died from Ebola on Wednesday. Officials with the hospital say the nurse did everything by the book.
This individual was following full CDC precautions, which are barrier and droplet. So gown, glove, mask, and shield. But we're confident that the precautions we have in place right now are protecting our healthcare workers.
Hundreds of nurses rallied on Sunday demanding better training on handling Ebola.
We're seeing that caregivers who are not being adequately trained are being blamed, and we're hearing that they have not followed proper protocol when we have been asking our hospitals throughout the country to provide us with training.
Meanwhile, in West Africa, the situation isn't getting any better. The World Health Organization putting the current death toll at more than 4,000. Starting this week, travelers arriving from the three nations hardest hit by the virus are getting special screening at several large airports, including having their temperature taken.
And looking ahead, later today we do expect to learn more not only about this case, but also a separate possible one on the East Coast, specifically a man who traveled from West Africa to the Boston area. He began to show some symptoms here. He was immediately quarantined. His blood test, those results are pending this morning. However, officials saying that he does stand a very low risk of actually having the Ebola virus. Reporting in Dallas, Texas this morning, I'm Polo Sandoval.